to a Deadly Silence. I'm your host, Larry Curtis, and it is the goal of all of us associated with our program to bring to you educational information associated with the epidemic of alcohol and drug abuse that is surrounding our South Shore community. Today with us is a special guest, Dr. Peter Rappo, pediatric physician from Brockton Pediatric Associates of Brockton and West Bridgewater. Dr. Rappo, welcome to our program.
Thank you. Good evening.
Thank you for being here. Today's program will focus on the use of marijuana and its possible effects on our young children who think it's cool to smoke. I want to cite a couple of statistics that I found during research. From the National Institute on Drug Abuse, it shows that approximately 9%, or 1 out of 11 of those kids who use marijuana for the first time will become addicted. This rate actually increases to 16%, or 1 out of 16, when you start in your teens, and it goes as high as 20 to 25% for those teens who become daily users of the drug. Additionally, among young people in drug abuse treatment centers today, marijuana accounts for the largest percent of admissions, 61% of those under the age of 15, and 56% of those in the ages of 15 to 19 years of age. Dr. Rappo, based upon these type of statistics that we see out there, and as a pediatrician yourself, can you start off by identifying for us what is marijuana, and are there different types of strengths of marijuana out there today?
That's an excellent question. Marijuana is a herbal plant. It's a drug that's been around, as far as we know, for centuries. It's been acknowledged to be a psychoactive substance. It can come in a variety of forms. There's a variety of nicknames or terms for it, whether you're talking about marijuana or weed or tea or cannabis. But the bottom line is that these are parts or whole of a plant, whether we're talking about leaves or stems or seeds, that when ingested or smoked tend to have a euphoriant or psychoactive effect on the individual patient. And I guess part of the issue is nobody really knows exactly how they'll respond to any individual drug or medication. There are some people who use marijuana and have really no effect from it. There are other people that have fairly dramatic effects. There's a fairly good scientific literature that suggests at best marijuana becomes the great demotivator. People who use it on a regular basis tend to not have the same level of ambition or drive as other individuals. I think we can all recall in college the individuals down the hall in the dorm who were regular users of marijuana, reefers, stoners, whatever the name was back in the fabulous 70s. And I remember a couple of folks on my quarter who were good people, but they'd start off smoking first thing in the morning, and they'd blow through their 8 o'clock class, and they'd blow through their 9:05, and then they'd blow through their 10:10. And it was very clear that their focus became more the use of the substance rather than what they were there for as college students. So I guess the bottom line is you don't know exactly what effect any of these medications, whether you're talking about marijuana or other drugs, are going to have. Mickey Mantle, the center fielder for the Yankees, once said, had he known he was going to live this long, he would have taken better care of himself. Well, and Mickey, unfortunately, was an alcoholic, and I don't think he envisioned that during his playing career. But all of us, I think, need to take good care of ourselves because we don't know how long we're going to live, and we want the quality of our life long term to be satisfying and proper.
As a phisian, and you mentioned earlier about the 70s. I'm a child of the 70s myself, and you think about the Vietnam War and the troops over there smoking, things of that nature. During the course of the last 30 plus 40 years now, what changes have you seen in relationship to the acceptance or rejection of marijuana among the young adults today, the children of the teenage age?
Also a fair question. I think if you go back even further, there was a movie in the 1930s called Reefer Madness, which was very much an over-the-top presentation of the effects of marijuana. It almost became a caricature. I think people looked at that and said, well, this is a joke, it can't be this bad. I guess in the 70s, the idea was best portrayed by our friends Cheech and Chong,
yeah, Up in Smoke.
Up in Smoke, and it became again a parody. You thought about these guys who were smoking giant marijuana bongs and then, going out and eating 6 cheeseburgers. The idea was somehow this is what it did to you. You got silly, you had a good time, and you went out and ate. You ate everything in sight. And I think what's been very interesting in the time that I've been in practice over the last 34 years or so is that marijuana, the character of it has changed. Our friends in Canada lead the way in terms of the wonders of hydroponics, in terms of coming up with marijuana potency that is actually significantly greater than it was before. So I think we are dealing even with a very different product than we were dealing with 30 or 40 years ago because of the potency of it.
And is that potency leading to a higher level of potential addiction? I mean, just focusing on the marijuana itself?
Yeah. Again, it's a fair question. There are going to be some people who will be exposed to a drug on one or two occasions and become potentially addicted to it. There are other people who will not. And individuals, patients never come in with a label on their forehead that says, I'm the one. If I take this once or twice, I might have a problem. I wish they would. It would make our lives a lot easier, but they never do. And so it's hard to predict what the effects of on any individual are going to be. So you have to assume that everybody's at some risk. And I think, if people are feeling really good about themselves, they don't necessarily need to use substances. But I think for a lot of folks, the use of marijuana becomes a discussion of self-esteem. They, for whatever reason, their lives are not where they want them to be. So they feel the need, in a sense, to self-medicate. And ultimately, for many folks, although peer pressure will have a role in terms of marijuana use, I think for a lot of folks, once they start using it, it becomes a self-medication thing. Things aren't the way they'd like their lives to be, therefore they're going to medicate.
So they're escaping to a certain extent from whatever their lifestyle may be, or whether they feel down about their lifestyle. They kind of, this is their little escape.
Exactly. Well, they're treating themselves symptomatically.
Yeah.
They're not feeling good about themselves for whatever reason, and therefore they're going to self-medicate.
In relationship to its effects on the mind and the body, what would you say to parents out there as to signs they might want to look for?
Well, apparently in the brain there are receptors that are particularly responsive to the effects of cannabis. THC is the active chemical in marijuana, tetrahydrocannabinol. And for some individuals, it can have effect on learning centers in the brain. Certainly has effect on memory. As we've already alluded to, it certainly stimulates those centers in the brain that relate to appetite for a lot of folks. And so each individual responds differently. I mean, to a certain extent, it's like with pharmaceuticals. I mean, with the medications we use for patients, each individual may have a different side effect profile, may have a different response. But there's no question that the use of marijuana impairs memory. It certainly impairs judgment if you're driving. I mean, if you look at the number of accidents, even fatalities that relate to marijuana use, the numbers are fairly substantial. It is probably one of the more common drugs, along with alcohol, that we see involved in teenage fatalities for auto accidents, because clearly, although people think they can drive well when they're using a drug, they can't. Their depth perception is impaired, their concentration is impaired, their ability to even pay attention to what's going on. I'm stunned nowadays as I think about people who are driving and texting. Well, I guess the ultimate would be driving, texting, and using a substance all at the same time. Can't be a good thing.
Well, it's interesting that you mentioned about the driving aspect of it, because one of the other issues within the National Institute on Drug Abuse that was identified is that marijuana is the most common illegal drug found in drivers who die in automobile accidents, approximately 14%. And, again, as you're saying, a question I'd pose is, what skills are affected should someone decide to smoke and drive, basically? Yeah.
Well, again, depth perception for sure is impaired. And obviously depth perception is pretty important when you're behind other vehicles operating at high rates of speed. Your concentration is impaired, and your decision making is impaired. You're not able to make the kind of split-second decisions when you're impaired from a drug like marijuana, which being behind the wheel of a 2,000-pound vehicle requires.
Right. And it's not so much just for the driver himself, but teenagers today get into a vehicle that somebody may have smoked, or taken alcohol, and they become a passenger in this particular vehicle, and not realizing that because of the effects of the drug, that the driver could be putting their lives at risk, or the lives of other people out there, more importantly.
Exactly. That's actually a question we have on the adolescent behavioral questionnaire that we use in our office that talks about, have you been in a car was somebody who was high or intoxicated. And it's a depressing statistic because a lot of times people have been drinking, using marijuana, and their friends get in the car. I suggest to them that's a bad career decision, and sometimes they'll say, well, it wasn't that bad. He wasn't that drunk. He wasn't that impaired. I'm not sure you can tell, to be honest with you.
It's no different than a driver who drinks, gets in after
Exactly.
.08. Their reflexes, responses are impaired as well.
A lot of times those drivers think they're doing fine, and of course we know they're not.
Mm-hmm. You mentioned a questionnaire just a moment ago that you give to, I guess, the young adults, teenagers who come in and so forth. What type of responses do you find on the questionnaires of maybe talking about drugs, maybe marijuana specifically? And what do the parents respond to those type of, how does a parent respond to you as a physician? You're trying to keep confidentiality issues for the child or the patient that you have in relationship to the parent's role and responsibility.
Yeah, I think parents are very respectful of the need to have their kids have the ability to talk directly to a physician in a way that they'll know won't necessarily compromise that physician-patient relationship. There are some responses on an adolescent questionnaire that will require breaking confidentiality in terms of our feeling that a patient sort of has an imminent risk to themselves or another individual. But by and large, with the confidential questionnaire we use, I'm impressed with how often patients are willing to be very honest about their responses. And I will say that usually when you see a positive response to, say, marijuana use, you also see positive responses to other substances, whether it's nicotine and tobacco or alcohol or even other drugs. So it doesn't seem like it's an all or nothing situation. It's unusual when you have a positive response to marijuana to have that be the only positive response.
Let's reverse the question and say, from the standpoint of a parent's perspective, if a parent suspects that their child may be involved in some form of alcohol or marijuana use, do they actually approach you when they make an appointment and say, Dr. Rappo, I'm concerned of such and such, could you maybe probe a little bit? Is that a situation?
Oh,
that might
absolutely.
happen?
Yeah, our patients are not shy. They'll let us know what they feel their needs are. And we'll actually have some parents who will ask for a drug screen as part of the discussion. And occasionally we'll have a parent who will ask us to do it, sneakily, and we won't. I mean, if we're going to be doing screening, we're going to let the patient know up front. And for most kids, that's not an issue. They'll allow us to do the screen. Patients are sophisticated enough to know, though, that marijuana, because it's absorbed into fat, can be around for as long as 21 days. And so the likelihood of having a negative screen if you've used recently is pretty low. And the kids acknowledge that. But I think there is this sense that somehow marijuana is, okay, whereas other drugs wouldn't be.
It's a cool drug versus
Yeah.
an addictive drug.
Exactly.
To some degree.
And I think part of our role there is to make sure they understand that this is a real medication. This is a medicine that really does have a variety of effects and side effects, for that matter. I guess it's interesting if you think about it. We've raised a generation of kids who, if they thought that the Twinkie wrapper had been tampered with, they wouldn't eat it, or they think that the chicken comes wrapped in styrofoam and plastic,
Right.
and that's how food is. And yet, it is interesting that people will go out on the streets and buy stuff from somebody, and I asked them the question: Would you eat something in a package that you thought might have been tampered with? And the answer is, well, no, I wouldn't do that. Well, where did you think this came from?
Right.
I mean, this is not the FDA that's distributing this product.
And that leads to some concerns of potencies of the different type of drug that may be, being peddled out there on the street. And
Well, as I was saying before, marijuana is more potent than it used to be. And people get into this term laced marijuana, which is marijuana that's been adulterated with something else, whether it's PCP or whatever. We're not even talking about laced marijuana. We're just talking about regular old garden variety marijuana. As I said before, it's much more potent than it used to be. There was an ad on television about "This is not your father's Oldsmobile."
Yeah.
This is not your father's marijuana.
Good point. Good point. When you talk about the teenagers, they're in high school, and from that perspective, and the effects that it has on their ability to perform their school responsibilities. What should these children be aware of? I mean, basically, when we're talking about going to college, preparing for college and so forth.
Yeah. Well, again, it does impair memory. It does impair concentration. It does impair reactivity. Obviously, some kids, if they're using it on a regular basis, are fatigued after the process. I mean, it's euphoriant initially, but then, of course, they stop smoking. They're sort of feeling down afterwards. So it's not a drug. It is a drug. We shouldn't necessarily think that there aren't going to be effects or side effects. It's sort of like the discussion we have about herbal medication. Patients will say, I don't want to use those medications you prescribe, doctor, but I want to use herbal medications because somehow they're safer. Well, most of our medications that we have in medicine come from herbs, come from plants. That's where they all come from. So I think you have to acknowledge that medications like marijuana do in fact have effects. And again, I wish there was an absolute profile that you could talk about for every patient. This is what's going to happen. Everybody's different.
Everyone's different from that perspective.
We do know that people who use it chronically, who have a high marijuana use, early use, heavy use, there's a fairly good scientific literature nowadays that talks about the fact that they can really become really paranoid from the marijuana. And there's no data that suggests it causes psychosis, for example, but we do know that people who have underlying mental health issues like psychosis are worsened considerably by the use of marijuana. And sometimes these patients are also using it for self-medication purposes.
That was actually leading into one of my next questions of the mental illness aspects of the drug on the teen or even the adult from this perspective, you know. Because, I mean, a lot of teens today are looking at their parents who may have used it back in the 70s, you know, or 80s, you know, and Mom, you used it, Dad, you used it, you're okay.
Right.
Allegedly.
Well, but again, had we known we were going to live this long, we all would have taken better care of ourselves. You know?
Yes, we would have, for sure.
It wouldn't occur to me to use something I didn't understand what the effects were going to be. I wanted to be that kind of control. But again, I didn't need it for self-medication purposes. I think so often for patients, they're using it because their lives are not what they want them to be, and they somehow, at least short term, can get, at least in their minds, an effect that it is decreasing their stress, anxiety, whatever name you want to look at it. I will say that we live in an awful stress-filled era, if you know what I'm saying.
Absolutely.
Parents will come in and talk to me about, you know, they're worried about their child, and yet the phone rings or they start texting in the middle of a discussion. Well, shouldn't we be really focused on the needs of that individual? Let's not do anything else right now. Let's just focus on the needs of this person right now.
I mean, you had mentioned earlier that marijuana can stay within the system for a certain length of time. I think I heard you say 21 days. You know, and I think part of the concern that the young teenagers don't understand today is that if they're out there today pursuing jobs, and a lot of employers today, you know, may have mandatory drug testing as part of a pre-employment, you know, physical and things of that nature, that, you know, if they have an opportunity to get a good job, you know, whether it be working with the family business, the parents, or anywhere out there, hospitals today, a lot of hospitals employ a lot of young high schoolers and college kids from that perspective there. You know, they don't realize that this drug is staying in their system, even though they think maybe I didn't smoke it last week, so I should be okay. So, and one of the other things I hear out there is that, oh, they can take some form of a liquid, you know, drink of some sort that will cleanse their system out. Is that valid? Yeah.